Hello, everyone. Thank you for joining us. Today, we're going to have the opportunity to hear from a number of states about what's possible in regards to moving toward prevention. Before we jump into that, though, there are a couple of housekeeping matters that we want to cover. If we could get the next slide. If you are, there we go, we'll get straight to housekeeping. So as was mentioned, the webinar is being recorded. There are a handful of resources that are available to you in the handouts download box, typically to the right of your screen. If there are any of those that you would like, you can simply click on them and download. There's a one-page summary from each of our presenters today to help you kind of solidify those tips and take notes about where they're headed. Participants may ask questions or make comments using the chat pod only. We have a large number of people on the line today, and it would not be feasible for us to have people ask questions via voice. So we ask that you just type those in. It also gives us the opportunity to collect up those questions and then respond back in such a way that everyone will be able to see what the questions and answers are as well. Your phone line is muted. That's to reduce feedback and room noise. Again, as I mentioned, we have a large number of phone lines out today, so keeping control over that is helpful. In just a few minutes, I'm going to ask you to actually turn your audio on your computer. We're going to be watching a video from Dr. Milner, and the best way to hear that is through your computer. It will not be available if you are only on the phone line. It will be silent for you for a few minutes, about 10 to 15 minutes, but you will be able to hear it through the computer. If there's anything at all that you have questions about or you have any technical difficulties, again, I would encourage you to type those into the chat box, and we'll do our best to help you as quickly as possible. If we could have the next slide. All right, so some of you may be asking kind of where are we going from here? What is this all about? And as I mentioned in the beginning, the Children's Bureau is really inviting states to think about the Child Family Services Plan in a different light. We're inviting states really to think about how to step out and do things a little bit differently and chart a different course through territory that you may or may not be familiar with. So starting back in last July, there was a meeting many of you were present, you may recall or you may have heard about in D.C., where state teams came together to begin to think more broadly about what's possible in the child welfare arena, and particularly about what it might look like if we all shifted our focus towards the idea of prevention. That's being bridged with this meeting, this webinar, and ultimately we'll come together again in April in D.C., where the Children's Bureau, working with the Capacity Building Collaborative, is working to help you understand and think through how it is that you might do things differently. What does that really mean to have the opportunity to do that? Explicitly, Commissioner Milner and the Children's Bureau are calling on states, tribes, and territories to work together as a broader system, to look beyond just the Child Protection Agency and thinking about what is child welfare, what does child protection really mean. It's an opportunity to develop a joint vision for how you want your children and families to experience the system in your jurisdiction. It's an opportunity to think about what are the outcomes that you really want to achieve as a whole for your community. The Children's Bureau has invited everyone to think about the Child and Family Services process as a roadmap for that, a way to bring your vision to life. Oftentimes we get stuck in this idea that things like the Child and Family Services Plan is something that we have to do extra or something additional. But the reality of the matter is that the Children's Bureau is very open at this point to that being a roadmap for the vision that you want for the broader system. So it's not a separate thing, but rather a highly integrated way to bring your state's vision to life for how you want to serve children and families. The Children's Bureau is calling on all jurisdictions to design with key partners in this regard, and that includes the legal and judicial community, prevention partners, health partners, community partners, and most importantly, the voices of parents and youth with lived experience, because they are our experience. They are the people who can best inform what it's like to travel this journey. You're going to hear today from a couple of examples of how states and a county have leapt into action since that meeting back in July. You're going to hear from people who are at different points in drawing their map through this land. You're going to hear from Judge Swope in West Virginia, who's literally started writing his map on the back of a page during the conference. You're going to hear from folks from Delaware who've begun to really kind of lay out the land and get to a point where they have a clear map and it's a matter of formalizing things. And then you're going to hear from the Jefferson Prosperity Partners, where really they're at the edge of the land, at the edge of the map, seeking new ways. Many of you, I think, will listen to that and think, wow, how do we get there? How do we get out to that edge as well? So there should be something for everyone, no matter where your state is at in this journey. Most of all, you're going to get to hear just a variety of perspectives, a variety of ways, a variety of visions, and how that might move forward. When we're done hearing those three examples, we'll hear some closing comments. Commissioner Milner and David Kelly are watching along with all of you here, actually up in my home state, up in Washington State, with a group of folks here. And I think at that point, at this point, we're actually just kind of ready to move on. So I would ask for our next slide. And so this is the opportunity here to be able to hear the video. You're going to have to, rather than listen on your phone, you're going to have to listen on your computer. So I'm going to give just a minute for everyone, if your computer was on mute, to unmute now and turn up the volume. For those of you who are just on the phone line, you're going to have a little bit of silence for a few minutes here, and then we'll jump back in. So if we could roll our video of Commissioner Milner now.
Hello, and welcome to this webinar, which, as you know, is a follow-up to the state team planning meeting work that we began here in Washington, D.C. last July. Over the past approximately year and a half, you've heard a lot of talk from the Children's Bureau about the need to reorient, reimagine our child welfare system to one that focuses much more squarely on building and strengthening the protective capacities of parents to care for their children in safe and healthy ways. You've heard us talk an awful lot about the need to focus much more squarely on the prevention of child abuse and neglect before it occurs. Well, I think that most of us would agree that this is a noble and worthy goal for our child welfare system. I think that we still struggle in many ways with conceptualizing what that kind of a child welfare system would actually look like on the ground in our day-to-day work. It's not unusual for state and local child welfare leaders to say things to me to the effect of, how do you expect me to do all that we're doing already with the increased demands on our child welfare system and do prevention on top of that? My response to that is very simple. I don't expect you to do prevention on top of what you're already doing. I expect us to find a way to do prevention instead of much of the work that we already do, recognizing that there will always be a need for foster care, for child protection services, but also recognizing that with effective prevention programs in our child welfare system, we have an excellent opportunity to reduce many of the crises that keep us busy in our day-to-day work so often. I'd like to share with you, if you would, an example of a program that I recently was able to visit that I think is an example of what primary prevention can look like in our child welfare system. I recently made a trip down to South Carolina, and I found myself in a small conference room of a community-based prevention and family support services center that was largely funded, is largely funded by the state's Children's Trust Fund. I'd like for you to imagine with me for a minute some of the faces of the people who were in that room with me, particularly 5 young mothers in their late teens, early 20s, I would guess, and a grandmother. Each of them struggling with their own individual challenges and difficulties, but united by one challenge, the challenge of raising babies virtually on their own. They were separated by geography from important family supports and extended family that otherwise might have been able to help them with their child care responsibilities. The young mothers were struggling to continue their education in the face of raising an infant. And they admitted to not being prepared for the challenges of raising an infant when they first found out that they were pregnant. 5 of the 6 mothers in the room were raising infants that the research tells us are the most vulnerable to child abuse and neglect in our country, the most vulnerable to death by child abuse and neglect. Add to that tremendous risk factor other factors present in the lives of these mothers and these children: social isolation, the youth and inexperience of the mothers, lack of knowledge about child rearing and child development. We know that many of these risk factors can lead to very detrimental consequences for children. Yet, in spite of those risk factors, not one of the mothers or their children had any formal contact with the Child Welfare Agency. Which begs the question, why? With all those risk factors present, why would they not be involved with child protection? The answer to me was really quite simple. Because each of them was connected from the time they brought their infants home from the hospital and before there was time for anything bad to happen to those beautiful, thriving babies. They were connected to one of at least 3 home visiting programs that are operated by this community-based family support services. They had access to medical care for themselves and for their babies. But most importantly, they had someone to turn to in times of need. They agreed to the help. The services were voluntary, and a report to Child Protection was not necessary in order to mobilize those services. Instead of being able to sit there in that conference room and have a beautiful, responsive, inquisitive little girl whose name was Lindsay, by the way, wrap her fingers around my finger and smile at me so easily and so freely, the way we want to see babies smile when they're thriving and healthy. Instead of being able to watch their mothers smile back at them, to love on them, to give them nurture and support, I could just as easily have been in that conference room or another conference room with overwhelmed, traumatized mothers and non-responsive infants who were not having their needs met. The latter has been my more typical experience in the child welfare system. We could easily have been in a room with parents who were deeply wounded over their experiences in child welfare. I've met with those parents all across the country, in your states. I've sat in rooms and I've listened and watched them break down in tears, talking about the heartache that they've experienced over not being able to care for their children and to parent them in safe ways. I've heard them talk about the devastation, the incredible loss that they've experienced in child welfare. I've heard them talk about the services that might have been helpful to them had they been offered and had they been available, instead of the stories I heard in South Carolina about the effectiveness of the services that were offered to them even before they asked for them. In South Carolina, every one of the women in that room said that the difference for them in having their experience, as opposed to the more common experience that I'm accustomed to, was the fact that they were connected, that they had that source of support that they could draw on in times of need. I believe that we could help young, unprepared mothers to have that same experience most of the time. Yet our typical response is not to do that, but to wait. We wait until a report comes in to the hotline. We wait until a child has been abused or neglected. We wait until a child is at imminent risk of entering foster care. We wait until parents are so overwhelmed and experiencing such levels of difficulty that simple family support services may no longer be effective in helping them to parent their children in safe ways. The point of primary prevention is the amazing opportunity that we have to put services into place before families reach the point of crisis, before children are harmed by otherwise loving but simply overwhelmed and unprepared parents. The failure to put those services into place, in my opinion, leads to the fact that up to 60% of the children in our child welfare system, in our foster care system, are there due to neglect. Neglect that is often exacerbated by the effects of poverty. Yet we continue to allow that to occur over and over and over again. Can any of us believe that that's an acceptable way to have child welfare in our country? That it is just, that it is even moral? I hope that by now, and I trust that we can agree that it's not. Yet it is what we do, and we pay for it with the price of trauma that repeats itself over and over again, over generations and over lifetimes. Over the past nearly 2 years now, I've traveled from coast to coast multiple times looking at the programs that are making a difference in the lives of children and families. I've talked to those children, I've talked to those families, trying to understand how we can support the strengthening of parental protective capacities. My takeaway from those visits is that this is absolutely doable. It's something we can do as a child welfare system. But in order to do that, it has to be your vision, not my vision, your mission, your commitment, your charge. In the Children's Bureau, we recently released an information memorandum, IM number 18-05, that discusses the need to refocus our child welfare system to one that emphasizes primary prevention of child abuse and neglect. And we describe many of the stellar examples of programs that are doing just that in their communities across the country. Over the next year or two, I would love nothing better than for the Children's Bureau to be able to update that information memorandum with a much longer list of stellar examples from each of your states. And I believe that we have the opportunity to do that. My charge to you at this point is to take advantage of the tremendous opportunity we have right now to reimagine what child welfare can be in the United States, to work together as a team, not just the Child Protection Agency, but the agencies, public, private, caretakers, the legal judicial system, the service provider community, to create the kind of family support system in child welfare that would allow so many more parents and so many more children to have the experience that I was fortunate enough to be able to witness in South Carolina. I urge you not to let this opportunity slip away. And I thank you very much for coming back for this webinar, and we'll look forward to seeing all of you again in April when we reconvene the state team planning meetings. Thank you.
So we'll get to hear more from Commissioner Milner at the end here, along with some of our colleagues in Washington State. I just want to add, for me, I'm actually a fan of travel memoirs. I love to read about people's travels. And one of the things that I think this webinar kind of reminds me of is just that. It's an opportunity to travel around the country from the seat of your own home, but in a very special way, to hear a very special kind of travel, to see what people are doing around the country, and also to see, as I mentioned, in various stages and points. So our first speaker here is, you might be wondering, some of you might be wondering, I don't understand this map thing. I don't have a map yet. What do I do if I don't have a map? Or what happens after I first start sketching out that map? Then what happens? What happens next? And our first presenter, I think, can really give you a great story and a great feel for what that might look like. Honorable Derek C. Swopes. He's a circuit judge in the 9th Judicial Circuit in Mercer County, West Virginia. And I know that you're going to love this presentation because I've enjoyed hearing it a couple times as we were preparing for this. So welcome, Judge Swopes.
Thank you. Good afternoon, everyone. I'd like to thank Dr. Milner and David Kelly for the opportunity to present to you all today. I'd also like to thank all those who helped prepare for this very important conference. I'm very humbled to speak with you today, and just a little bit about my background because it'll help to determine how I got to this mapping process. I've practiced law almost 41 years, 22 and a half years as a private attorney, and 18 plus years now as a circuit judge, which is a general jurisdiction judgeship. Early in my career, I was a part-time assistant prosecuting attorney, and among my duties was to cover what's now called abuse and neglect. And it took one Friday morning a month to do that. After that stint, I focused on civil litigation in my private practice. When I became a circuit judge on January 1st, 2001, a whole new world had emerged. We had an exploding criminal docket, an exploding abuse and neglect docket. They grew hand in hand. Our drug epidemic was taking off. The substances of choice had gone from alcohol to Tylox to opiates during my career. This, combined with the economic downturn, put us even deeper in the hole for our families. On the criminal side, locking up people for addiction just wasn't working. So we set up community corrections in 2003 and an adult drug court in 2006. In those processes, we developed a network of partnerships to help us in these endeavors. I had a lot to learn about abuse and neglect. It took increasing amounts of my time, and it so increased our docket that we added another judge to our circuit. After a few years, I was asked to become a member of our Court Improvement Board, and I willingly did so. My subcommittee has worked on rule and statutory changes, uniform case plans, data collection and standardized orders, among many things. I also served as a CFSR reviewer in 2008. In early 2017, I was honored to be named CIP chairman by the West Virginia Supreme Court of Appeals, and I attended the first summer state planning meeting in Washington that summer. In early 2018, the world as we know changed with the passage of Family First. And I went to the July 2018 conference in Washington and heard about Family First in depth for the first time. In 41 years, I've seen the wheel reinvented many times, and it still appears in the end to work the same way. So as I heard the presentations at the beginning, I was wondering if it would be more of the same. As usually happens when the charts go up, West Virginia is always near the top in the number of children in foster care. This time would be no different. We have struggled with how to break this cycle during my entire career. Now comes the climax to the story. I was born in Baltimore, Maryland, and raised in Howard County, Maryland, which is a neighbor to one of the first presenters that I heard, Montgomery County, Maryland. When I heard that presentation, because it was a county I was familiar with, it truly sparked my attention. I was sitting up near the front of the conference, and so not only did I listen to the presentations, but I watched the passion of the people who made them and realized that they were truly committed to what they were talking about. As I listened to them, I was amazed at what they'd done as a county, which now had limited resources, and building a truly prevention-built system that works. Rather, a true prevention system that works. I listened then as folks from Brooklyn, New York, and Colorado gave their presentation. During this time, it's no exaggeration to say that the scales fell from my eyes. These folks had reached out into communities and built coalitions of skilled people from multiple diverse professions and backgrounds to create systems that work. It dawned on me that this is how we built our drug court system, from the ground up, with local resources. I literally flipped over my agenda, and as the speakers presented, I resource mapped all the partners who helped us with our drug court. We now have a truancy diversion program and have added more partners. If you can put up the slide, well, I'll show you the evidence. We have a program, there it is. There's my agenda. You can see I went through everything, and on the right, I flipped it over and scribbled down everybody I could think of that had helped us in these other endeavors and how they could come to help us in this process. We've also added, there's a new program here, it's been several years, Safe at Home, which exists to serve families holistically in the home. Before I left, I don't know if you remember this, but I went to Dr. Milner and shook his hand because he was at the next table, and I told him that I had a plan in mind and I would be back with him. As a child, I grew up watching the great Universal horror movies of the 30s and 40s. And as I pitched my idea to different people, I used the example of the Frankenstein monster, and I think we have another slide for that. Like Dr. Frankenstein, I would piece together the parts that we needed to build a prevention network. But unfortunately, Dr. Frankenstein was cursed because he used the wrong brain. I would use a different brain this time as we put the pieces together to build a true prevention service that would work for our families and children. All the names on the list, with others yet to be thought of, would help us build this program. And like Dr. Frankenstein used electricity, I would use the spark of Family First to give our program the spark of life. As soon as I got back, we started working. I learned that there was a Department of Health and Human Resources community service manager in the Eastern Panhandle of West Virginia who had been basically doing the same thing for years. So, doing the programs that Maryland, New York, and Colorado are doing. So I reached out to her. She joined us at our initial team meeting in August, and we began to arrange how we could work together to set up our prevention model. I went to the NAC conference in Texas in August and learned additional things that were truly helpful. I set up my initial stakeholders meeting in mid-November and had almost 50 representatives from various agencies, partners, as well as political officials. Although I liked my Frankenstein example, I used a different symbol of my past experience to explain what we needed to do. I spent 30 years in the United States Army, most of it in the West Virginia Army National Guard, and I was a tanker. So I started my presentation with a picture of a Sherman tank. What does a Sherman tank have to do with child welfare? What it has to do is this. When the United States entered World War II, there was a gap in the production of armored vehicles, and there needed to be a process by which tanks could be built quickly. So one industry took a Sherman tank, disassembled it down to every minute component part, laid it out on the factory floor. Then it invited representatives from various companies, large and small, mom and pop businesses, who inspected each piece of the tank to figure out what their company or individual could build to build the collective tank. And in a short period of time, every piece was accounted for, and the tank production began in great numbers. So what I wanted to do was disassemble the tank the way our forefathers did, take it down to its basic component parts to figure out who among our partners could do what. We met again in a few weeks. Then several of us had the pleasure of attending a one-day Family First meeting in Charleston, supported by the Casey Foundation and the Children's Bureau. I met Dr. Milner again there and told him that we were working away and received his heartfelt encouragement. His remarks gave me more inspiration that we were on the right track, and I saw Family First as a means to an end, a prevention program that would truly work and change the way we have done business. We recently had a video conference with our Eastern Panhandle partners who presented their programs. 10 different persons from different agencies presented to the programs that they had to the 35 people attending at our site in my courtroom. Tomorrow we will put pen to paper at the DHHR. We'll figure out as a community who can build what part of our tank. I was asked how one could judge whether our project was successful, and I see that there are two very objective and simple ways to determine this. One, has the number of children in state custody decreased in my circuit? Two, has the number of contested abuse and neglect cases filed decreased? A word of caution. I started working on this in late July, and we're still in the planning phase in January 2019. Why has it taken so long? The answer is that I still have a day job as well. Along with an active docket, I'm on our state's mass litigation panel, chair our CIP, and have other responsibilities to the court. But I make time to do this. When we started our drug court, a lot of people showed up for the meeting, but it has taken years to build a committed team. We can short-circuit this process because we know who will work and what they will bring to the table. By Friday afternoon, I hope to have a good idea of who will build what part of our prevention tank. I really believe that we can make our prevention model work. Others have done it before there even was a Family First, and I'm thankful and congratulate them for their efforts. I really believe that judges are uniquely placed to lead a systemic change that will truly help us achieve safety, permanency, and well-being for our children. I've taken the liberty of sharing a few suggestions for building a prevention model, and I hope that you will consider them and find them useful. I'll close with the words of another of my favorite childhood characters, Dorothy in The Wizard of Oz, who said it best, "There's no place like home." And I think we have Dorothy here to prove that point. There's no place like home. Thank you so much for allowing me to tell you my dream and how I plan to make it a reality. And thank you so much for this opportunity, Dr. Miller and David Kelly. I truly appreciate it. Thank you.
Thank you, Judge Swope. Very much. I appreciate that. And for those of you who would like, the handout that Judge Swope referenced is in the handout section box. You can just click on that and download. Also, if you have questions, you can feel free to type those in the chat, and we'll do our best we can to get back to you on whatever questions you may have. And that includes if you have questions directly for Judge Swope. If you can't answer them in the chat today, we'll make sure that we get them to him directly so that he can connect with you. If we could have the next slide, please. So our next group of folks are going to be joining us from Delaware, and that includes Keith Zirkle, who's a Program Support and Resource Administrator for the Delaware Division of Family Services, Karen DeRasmo, who's the Prevent Child Abuse Delaware representative, and Rachel Neff from Family Court. And they are unfortunately unable to be with us on video, so you won't be able to see them while they're talking. But in some ways, I think that also helps to make the point that, you know, no matter what resources you have, you can make it work. If you try, you can make things happen. So I'm going to invite them to unmute their lines and join us now. We'll hear from Keith first, and then Rachel and Karen. And Keith, are you with us?
I am. Can you hear me?
Yes, sir. Go ahead.
All right. Thanks a lot. Good afternoon, everyone. So the Delaware team is going to talk about our past, current, and future collaborative planning efforts, and we're going to share this presentation as a team as well. So I have an opening question for you. So in your state, what would it look like if you believed, one, that given the right resources, families can make sound decisions about their children's welfare, and two, kids should grow up with their families? So based on those two principles, Delaware is looking to use the Child and Family Service Plan for the next 5 years as a launch pad to make some changes in our emerging child welfare system. So let me go back a few years and tell you a little history. Beginning with an Annie E. Casey Foundation engagement, Family Services launched 17 initiatives in 2012 to basically strengthen family engagement practices using evidence-based tools. Realizing the Child Welfare Agency can't do the work alone, Delaware does believe that child welfare belongs to a fairly wide range of service providers, both in the public and the private sectors. We believe that strategic planning follows the same path. So I want you to note the penny's motto. The motto on the back of a penny, and I'm a fairly old guy, and I'm just learning this like yesterday. So the motto on the back of the penny is e pluribus unum, out of many, one. And here's the point. Delaware has a long history of collaboration, especially for targeted initiatives, but we have lacked a broad, multidisciplinary, comprehensive strategic plan that really covered front-end prevention all the way through post-permanency exits from foster care. So the vision we have right now has evolved over the past 5 years or so from the Annie E. Casey Foundation engagement. The system has shifted in those years from thinking child safety for at-risk children is best assured through two basic pathways, either agency supervision or foster care removals. Since then, we've come to accept that there are other paths, that there are alternatives that are less intrusive, and we have an expanding use of differential response now that's been going on for about 4 years. Last summer at the initial planning meeting in D.C., Delaware's 3 grantees, the community-based child abuse prevention, court improvement programs, and the Child Welfare Agency, agreed to meet and try to better coordinate the 3 federal plans that we have. So while the 3 plans cover prevention through adoption services, we really lack the coordination of a single strategic plan. Prior child and family service plans were basically structured around federal funding streams and the outcomes and systems that states are held accountable through the Child and Family Services reviews. The 3 leads for the grants formed a Child and Family Services Plan Steering Committee in the fall, and that steering committee included children's mental health, prevention, early intervention representatives, community service agencies, and of course child welfare agencies representatives as well. We began monthly meetings in December, and an early activity was to form 3 work groups to organize the data gathering and assessment phase of our strategic planning. So the 3 work groups were to gather system data reports and statistics, develop and conduct stakeholder surveys, and conduct statewide focus groups with a variety of stakeholders. So we look forward to developing a living plan with annual updates and revisions. Organizing around the Child and Family Services Plan is a natural fit for Delaware to bring about changes. So I'm going to turn it over to Rachel to talk about what's happening now.
Okay, great. Thank you, Keith. So I think what I'm tasked with doing is talking a little bit about what we're doing now in Delaware in light of the meeting in July. And I think I don't want to go back too far in the past, but one of the things I want to say is that I think the work that we're doing in Delaware has been informed by individuals who are directly impacted by our child welfare system. So I think that when we come together in work groups or committees to talk about taking on or addressing issues or trying to find some solutions to problems, that it's important that we've gone through kind of an assessment process, and that assessment process has been informed by talking to our foster parents who are involved in our dependency and neglect work, talking with parents who have their children placed in foster care, talking with youth who are currently placed in foster care and who once experienced foster care. So I think that that's been something that the CIP has done over the last couple of years, and it's informed our work. And we've also done it from the practitioner side through our quality hearing surveys in terms of talking with parent attorneys, talking with our deputy attorney generals, talking with our judges and our state agency workers to make sure that we're getting feedback about how our process in the courtroom is working. So I just wanted to say that, and I hope that in my brief comments right now, one of the themes that will emerge is that we've been willing over the last couple of years to really, I think when we come together with the state agency and other stakeholders and the court to engage in problem recognition or looking at issues, and then also participating in problem solving. And I think those are 2 different types of things. So the forum, though, that we've been afforded to kind of address these issues since Delaware went through the CFSR, and we were charged with creating our performance improvement plan in 2016. We really had to get moving in 2017 on putting this kind of our performance improvement plan, the PIP, into action. And so the court obviously partnered in the permanency work group, and we co-chaired this along with a representative from our state agency. And our work group really had to, like any work group first coming together, had to kind of fumble through what is it that we're going to address in this work group for the next few years. And, some of our first agenda items, it's like who needs to be in the discussion, what are these topics that we're going to address. And we did get to a place, because we were meeting on initially, a monthly basis, on an every other month basis, of, okay, here's the things we're going to take on. And, for example, looking at cases that were out of guidelines in terms of reaching permanency outcomes for children, looking at our data as it related to some of our TPR filings and some of our family engagement work, looking at how we were approaching and utilizing concurrent planning in our cases. Our work group had to take on specific issues and then, as a team, come back and say, okay, where are we at with these certain areas? And so I really think that, and I'm so thankful that I have a great partner at the state agency, Robin Poor, who's worked on this with me. And, we've had to be accountable to our work group that comes together, as well as, obviously, accountability to the Children's Bureau and coming in and sharing, where we started and kind of where we've been as these several years have moved on. So that was the forum that kind of allowed us to take on some projects. And even though our PIP ends in the spring of 2019, there's still things that, since we've worked hard to put in place, we're going to continue to see through as time goes on. Since July, though, I would say there were 4 kind of significant takeaways. Since we were sitting there with our CB CAP lead and leadership from the state agency and judges and the CIP, we had to take away from one of the presenters there that really asked us to look at some of our short stays in foster care. So for Delaware, I think some folks thought, well, we probably don't have many children who are coming in and staying for 30 or 60 days and leaving. And so what we did when we walked away from that meeting was we actually did a run of, the children in our state who are impacted by a short stay in foster care, and thinking through, well, first of all, getting the data, looking at it, going back, talking with the state agency around it, trying to understand what were some of the reasons that led to these placements. Are there things we can think through? And I can say that when we reconvene in April, and actually sooner than that, that's something that we have a small group in our state looking at. Another one, we just had a meeting recently that was convened by Family Court. We had leadership from our state agency and judicial officer involved, talking about how do we prevent children who are active in the in delinquency proceedings, preventing them from coming into custody. That was another area that we thought needed some strategic focus. It was something that our state looked at about 6 or 7 years ago, and it was important to revisit it, so we did that. We've continued, we've reengaged in a partnership with Casey Family Programs to really look at some of our long-term stayers in foster care, and again, challenging ourselves to say, well, if there is a child who is experiencing 3 years or 4 years, that is a long time, and what's leading to that, and what can we be doing? Are there things on the front-end family engagement side that we could be looking at differently? And finally, just going back to my initial or opening comment about being informed by individuals impacted by our system, when we had done questionnaires and surveys with parents, and we got the feedback, like I'm sure many other jurisdictions receive, that there's not always a clear understanding of the process, and they're not sure what steps are taking next, and there can be that confusion. One of the things that we decided to do in Delaware was ensure that we were doing some additional training with parent attorneys, as well as looking at how could we perhaps conduct a pilot project around providing parents more front-end support and services as soon as they become active with us. And from a small pilot project that we just recently discussed, we did find that earlier support did have an impact on, number one, just them showing up to their hearings, on receiving more frequent visitation with their children earlier, completing elements of their case plans. And again, since this was a pilot and we're continuing to follow it and see it through, we'll see what ultimately it means for long-term permanency impacts. But I think engaging in a pilot program or trying something new and bringing it back and talking about it with our CIP steering committee was an important thing to do, and actually in talking it through, and we just had a meeting the other week, we said, what do we do with this information? Like, what does this mean for our system? What can we learn from it? And our state agency director had said, Rachel, I wonder if this is something that we think moving forward, how the Family First Act can help us in this front-end prevention piece with parents. And maybe we do need to think about, a variety of activities that we could be doing and in light of some of the opportunities that are available to us, even before perhaps parents get into a place where their child is experiencing foster care. So I think we have an opportunity, I think in light of all the work that's happened in Delaware over the last few years, in sustaining some practices, and we're looking forward to the convening again in April. And I think I'm going to turn it over now to Karen Durasmo, who's going to be talking a little bit about kind of where we do go from here in Delaware.
Thanks, Rachel. Just to touch a little bit on what Rachel said and to give you an idea about how inclusive the process of going through our last CF.
I'm not sure, we might have lost Karen there. What I'm going to suggest we do, we're still waiting to get Karen back, is I'm going to suggest that we move on here. You've had an opportunity to kind of hear a couple different ways of thinking about mapping ways forward. If we kind of stick with that theme, Judge Swope told you a little bit about what it was like to begin, what it looked like in the very beginning of mapping out his system. We've been hearing here from Delaware a little bit, and unfortunately we got right to the point where things were about to get into what we're looking at in the future, and we lost some audio there. But what I want to give you an opportunity to hear about now is something that we think is really exciting, and I know I've heard Commissioner Milner talk about this many times, is the Jeffco Prosperity Partners. One of the things that I think is most important about this is it's not just a trip in the landscape of child protection, but it's almost a travel through time as well. Jeffco Prosperity Partners, one of the things that you're going to hear about is that they're really aiming to have a multi-generational approach. So not is it just the scope of the current landscape, the scope of kind of what prevention might look like now, but it's actually reaching into the future and trying to make an impact there. And you're going to hear about that program from Jessica Hansen. She's with Jefferson County Human Services and the director of Jeffco Prosperity Partners. So Jessica, welcome aboard.
Hello, everybody. Thank you so much for the opportunity to be here today. The Jeffco Prosperity Partners community started over breakfast with our former executive director, Lynn Johnson, and our local superintendent. They started having conversations around what would it look like if teachers could focus on teaching and human services could assist with wraparound services and navigation. But after these initial conversations, we brought together a community of stakeholders to talk about what would it look like if we could do business differently. Our partners included the school district, our faith-based community, nonprofits, government, and business partners. We knew we wanted to start this project in Head Start based on it was one of the first and original multi-generational programs for parents and children. National data said that children who attend Head Start fall behind in third grade, and we wanted to know why. Every family in Head Start is assigned a family support specialist, and in this role, the role really supported families to make great gains, but what we learned is 1 to 2 years is not enough time to support a family combating generational poverty. And simultaneously, we are having conversations with parents, and we are learning about the transition into the public school system and how challenging it was. And as children got older and the curriculum got tougher, parents oftentimes felt unsupported. So the real goal of JPP was to be an extension of Head Start to support parents to self-sufficiency and youth to diploma and beyond. The development of JPP started through the Head Start Policy Council. Our executive director at the time, Lynn Johnson, asked families directly, what would it take to get you out of poverty? Our role was to listen. And what we found was the things we believed would help people get out of poverty oftentimes was not the case. Grandparents referenced respite care. In order to ensure that their great-grandchildren stayed out of foster care, they wanted a moment to be able to go and relax or even just go to church. Parents said reliable vehicles, and many families referenced having better lives for their children. Then we continued to push our parents, what do you need? What are your hopes and dreams? And many parents didn't know how to answer the question. Most families shared with us that many workers focused on their child's well-being, and parents had rarely taken the time to even consider or think about their own hopes and dreams. But after these initial conversations, we asked a few brave parents to see if they were willing to walk alongside us as we created a program that was going to support families on their journey towards self-sufficiency. JPP has a family advisory council to assist with the development of the project. We do not do anything without our families. We do with, not for. This means that our families in the project also sit on our hiring committee for the staff. We ask families, do you like this person? Many will say yes, and then we say, do you want this person to be your coach? And sometimes they say no. And this part's important because it's a key in deciding who will join our team. We have coaches, not case managers. This is because families have said, I have enough case managers, but I would like to have a life coach. Wealthy people have life coaches. JPP uses a multi-generational holistic approach. We have individuals in our program ages 0 to 74. We have 5 core components to our multi-generational approach. These include education, employment, health and wellness, economic stability, and social capital. I'm going to take a minute and just go through each of these and provide some examples. As you can imagine, all 5 of these areas are very much linked together, but it's helpful for us to be able to section them out, because when we're looking at a holistic person and a healthy and a thriving person, we feel like these areas are all critical. Education is a core piece of our program. Like I said earlier, we are looking at transitioning families out of generational poverty. This is a longitudinal program. As families opt into our program at the Head Start level, we are already talking about the importance of school attendance for their children. We need our children to be in school so they can learn. Quality education plus opportunity equals success defined by the individuals we serve, and we are seeing that over and over again. Many of our families have identified that continuing education and going back to school is a priority and a hope and a dream. We had one mother who was currently working 3 jobs, and her goal was to receive her bachelor's degree. We supported her on enrollment, and 3 years later, we got to the last semester of school. It was a degree in human services, which meant she needed to have an internship, which meant she had to take off work to be able to do her volunteer hours. As you all know, that a single mother cannot afford to do this, and so through partnership within our community, we were able to bring together her university, her employer, our workforce center to create a plan so she could continue her job as well as receive her hours, get the support she needed so that she could graduate. Once we figured out that barrier, we learned that she had to pass a math class. And this parent said, I cannot pass this math class, and we said, what do you need? What do you need in order for you to be successful? We are here to support you. And she said she needed tutoring. But when you work 3 jobs, it's really hard to fit that. So we scheduled a tutor to come to her house in the evenings. And so after a few weeks, we said, how's it going? She said, I'm still not passing. So her tutor went from coming 1 day a week to 4 days a week. which resulted in her graduating with her bachelor's degree and receiving a job in the career field of her dreams. This couldn't have happened without the partnership in our community and us listening to our parents. We also focus on employment, and when we talk about employment in our program, we're looking at career exploration and career pathways. We don't want our parents surviving on minimum wage jobs. We want our parents having careers and livable wage jobs and really moving from surviving to thriving. We had a parent come to us and tell us she wanted to be a medical assistant. And when we asked her why, she said because she thought it was a job she could have. We've had parents say to us, I want to be a hairdresser because it's the only career I've seen. So it's really important for us to give parents the opportunity to be exposed to potential career opportunities. And through these processes and these deeper conversations, we learned one mom was only 8 months away from a bachelor's degree, but the idea of going back to school and finding access to higher education felt so impossible to her, she didn't even want to mention it. We talk a lot about economic stability. I left that off to say that mother did end up just getting the field of her career. We also talk a lot about economic stability. It doesn't matter how much money you have. If you are unaware of how to budget and what financial literacy means, it's really difficult to survive on a tight budget. We offer courses on finances. We have partners who are banks. We're working towards finding ways to offer low-interest loans so families can improve and repair their credit. Educating families on the detrimental consequences of payday loans, and creating these partnerships within the community that we know will help our families. One of the things we talk about a lot is college savings accounts. And sometimes people say, how can you expect someone to save around a college savings account when we're barely surviving? But what we know is if families are saving for college, that means they're talking about higher education in their house, which oftentimes change the entire conversation. We have kids in our program who are in 5th and 6th grade talking about the excitement of college. We have parents who are returning back to school because their children are now in college and saying, if my daughter can do it, I can do it. So it's such an exciting part of our project. We focus on health and wellness. This includes dental exams, physicals. We know healthy parents have healthy children. We know that trauma unaddressed can cause significant challenges in the home. One of our mothers in our project came in and she was very excited because she wanted to go to college. She had experienced significant trauma and she told us, I hate therapists and I'll never go to counseling. And our commitment is to walk alongside families. So through this process, we talked with her over and over again about her hopes and dreams. And what she finally came to terms with is she said, I want to do better for my kids. I want my kids to have a safe and healthy life, and I want to go back to school. But I know that until I address my mental health concerns, I'm not going to be able to reach my goals. And now that parent is currently receiving intensive therapy with her long-term plans of going back to school. We know there's links between dental care and mental health. It's important for us to have these conversations so families not only hold themselves accountable, but through our project we talk a lot about a thing called social capital, and that's where we're really a community. JPP is not a program, it's a community. And through this process, our families are supporting each other. We have monthly meetings where we discuss our challenges and our celebrations. We have small groups that families let us know what they want to learn about, that talk about home ownership, healthy boundaries, nutrition. We have families focusing on supporting other families through difficult times. Poverty can be isolating, and we know that people thrive in communities. One of the key pieces of our project that families shared in the developmental process was it was very important for our families not only to receive support from us, but for them to be able to give back to the project. And we call that sweat equity. JPP is a community that works together. We have families supporting families. We have grandparents who provide emergency child care. We have parents who teach Zumba classes to other parents, teach how to meal prep on a budget, and provide peer mentorship to families who share similar experiences. Families know that being a part of JPP doesn't only support them, but their commitment to give back to other families experiencing poverty through Family Voice. We need to facilitate opportunities for policymakers and families to come together and have discussions around how systems can support families so families can support systems to thrive rather than being the barrier. JPP has families on the Medicaid Advisory Board for Colorado, the Child Support Commission, and they public speak throughout the country to ensure that Family Voice is always at the table. It can be challenging to develop a program that is family-led. Sometimes the feedback we receive is hard to hear, but at the end of the day, we are committed to creating a community that is thriving, and we cannot do that without listening to our families we serve. JPP truly believes that system change starts with families, and we believe that using a holistic approach is the way of prevention. Thank you.
Great. Thank you very much, Jessica. I appreciate that for laying that out for us. Next slide, please. So we've had an opportunity to see what this looks like from a variety of different stages in the process, if you will, all the way from the beginning of Judge Swope telling you a story of sitting in July, back in D.C. in July, making notes, to the process that Delaware is in the middle of in terms of moving forward and transitioning to formalizing relationships that have emerged, to the very comprehensive, in fact, multi-generational program that you heard about in Jefferson County, Colorado. And now, much like all good travel stories, at the end there's always the reflection, the travel log, if you will, looking back at what happened and the places that we went. And for that, we're going to go to Washington State and Commissioner Milner, along with some others, live. So, Commissioner Milner.
Okay. Can you hear us here, Tim?
We can. It's a little soft, but.
Okay. Okay. Well, first of all, let me just say an incredible thanks to all of you for putting this webinar together, and particularly for our presenters who have been pretty brave in coming forward and sharing both their successes and the challenges that they're facing in trying to radically transform what child welfare really is in their jurisdictions. It's incredibly heartening for me to sit here and to hear about those efforts for a lot of different reasons. I think part of it is that of all three of the presenters here today, what I've heard first and foremost is vision. We have a vision of how we want to serve children and families where we live, where they live, and that's leading and driving the work that we're doing. Another reason I feel incredibly encouraged and heartened is because we aren't just talking about a child welfare agency up there trying to get other people to come and play with us nicely in the sandbox. We're talking about joint efforts, a jointly owned vision, a jointly owned set of expectations that we can, as a community of child welfare, wherever we are, share and begin to make that our reality as we go forward. David, Paula, and I are just absolutely delighted to be here in the room with the Washington State team as we continue this effort to use the state planning process and all the other tools that we have to try to bring visions like this alive. I hope you can see that we got a lot of people around the table here. We've got representatives in this team of parents and youth who have lived experience in the child welfare system. We've got attorneys here that represent children, parents. We've got judges, at least one judge. I see we may have more than that. The CASA is represented here.
the court improvement program, service providers, and by the way, we have the leadership and the staff of the Child Protection Agency here as well. So that's pretty incredible, and I hope those of you in this room right here don't take it for granted that this doesn't happen all over the place. But this has to happen if we're going to really have children and parents out there who experience the child welfare system in a different way. I'm going to speak for Washington State and say this group of people, I have no doubt, has really accepted the invitation, just as Judge Swope has in West Virginia, and Keith and others have in Delaware, and Jessica and the folks in Jeffco out in Colorado. The challenge, the invitation to jointly create a vision and to move forward together to see how we can make that a reality, not just for them and their systems, but again the children and the parents that are part of that system. If we're serious as a system about strengthening families and preventing the trauma that comes from often unnecessary parent-child separation and disrupting those very difficult cycles that we all know about that are intergenerational, prevention has to be our common cause. It can't be just the cause of one of us or one group of us. It has to be something that we believe in and that we believe that we can bring to our work. And we all have an incredible role to play in that. The examples that you've heard about community-based prevention, other tool is one of the big tools. The Family First Act is an incredible tool. It's not the end. It's got to be a part of a bigger vision, but it's an incredible tool. The opportunity to have high-quality legal representation for children and parents, and we're trying our best at the federal government to make that more accessible to you. All of those things are tools to help us address some of the most difficult challenges that we have. Challenges that often include mistaking poverty for neglect. Jessica, I can't tell you how encouraged I am to hear, again, some of the work there that's going to the root causes of why parents come to our attention in the first place. Not just trying to fix something that's already happened bad in the lives of children, but trying to support those parents before they ever get to the point of needing much more intensive work in child welfare. Just within the past couple of days, David and I were down in California, down in San Diego, and we got to talk to another set of parents going through exactly the same kind of family strengthening, supportive programming there that is addressing their poverty, their need for very concrete things like housing, just in order to keep their families together. And I left there yesterday having spoken with parents who I have no question in my mind are thriving. Jessica talked a lot about thriving. Thriving, even living in very substandard circumstances. Thriving, still trying to get adequate housing and adequate employment. And one of the messages that came through in talking to those parents is what allowed them to thrive is that they were empowered. They didn't feel hopeless. They didn't feel like they were victims. They were looking for solutions because a community-based set of providers and people and primary prevention organizations was coming together to help them find some realistic solutions to the problems that otherwise could very easily land them and their children right in the front door of the child welfare system. This is possible. It is absolutely doable. Folks like the presenters that you just heard out there are doing it, and other people are doing it well. And we're gonna hold not just the Washington State team to your vision and your desire to make life better for children and families, but we're going to hold all of our state teams out there to this. We're approaching this with a tremendous amount of vigor, of enthusiasm, of urgency, and a sense that if we don't act on the momentum that we have going right now with our state team planning process, with Family First, with all of the work that's going on out there to move child welfare in a different direction, if we don't act on it right now, we're missing, I believe, one of the best opportunities that we have in our field to do something different and do something better for children and families. So thank you all again. Thank you, folks here in Washington State, for letting us come and share this with you. And with that, I'm going to turn it over to the Child Welfare Secretary here in Washington State, Ross Hunter, and let him share with you a bit of his vision and his plan for changing things here in Washington State.
So we're a new agency. Thank you for the gracious introduction. Thank you for coming and terrorizing us to make sure that technology actually works. He's coming. He controls hundreds of millions of dollars of our money. Make his technology work. So that seems to have worked, at least from our end, the whole time, thankfully. We're a little bit bigger than just the Child Welfare Agency, and we have an opportunity now to come at this problem, and I've been trying to structure my remarks listening to folks about we have an opportunity to come in from the inside out and the outside in. And a lot of the people here in the room today are our plan moving forward from the inside of the child welfare system out. So we have a 5-year plan. We have a PIP, a program improvement plan. We have a new permanency grant, the coordinating strengthening outcomes grant. I didn't put my reading glasses on. And these are all opportunities inside the child welfare system once families come to our attention to make the system work better. And we're going to do that. We're investing. We're going to be one of the first states, if not the first state, to really fully implement Family First. All of the work that we need to do to make that work. But we're really trying to also start on the outside in and start with what do we want to have happen for children. And so we have some goals for children. We think that they ought to be ready for kindergarten when they show up in kindergarten. Many of the kids we're most worried about are 2 years behind at that point and never catch up. We want to make sure they graduate from high school. We want them to be engaged. We want them to move on after high school because without that, it's going to be hard for them to be employed. We want them to be healthy. We have some broad measures that we are using about the health of both populations and the health of individual children, and we want them to have resiliency. And I first started out this goal as we tried to nail it down. It was an absence of further harm goal. Like, let's have them not come into the child welfare system or not into the juvenile justice system. And I got talked by our research team into, no, this is about not just preventing further harm, but it's about building that social capital, building the resilience in the child and in the family, because these children do not exist outside the context of their family. So we've started with high-level goals, and we bring, in addition to Family First, which is sort of an amazing gift, and thank you again for the parent representation money that just appeared in December. We're very excited about that. I'm here to thank you for money, right? I don't mean butter here, but is how we bring another $600 million in Washington to the table in our early learning focus, and how do we wrap not just the federal Head Start, but our state's investment in ECAP, which is significantly larger, in improving outcomes for at-risk children. 27% of the kids in our state-run preschool programs have regular interaction with the child welfare system. And we have got to get upstream. So all of our partners here, who are the courts, our providers, our public defense system, our child representation system, we all have to work together, but we also have to work together with the bigger systems that wrap around these kids to keep the kid and the family out of the juvenile justice system or the child. I'm happy to see you nod about this, because this is what we got to do to make this work, and I'm excited about the opportunity, but the inside-out opportunity of this planning process and the injection of new resources and new focus from Family First is a great opportunity for us. So thank you, and we're looking forward to working together.
Absolutely. Okay, are we pretty much done? Tim, I think we have done our thing here.
All right, perfect. Well, thank you to everyone for joining in. If you have last-minute comments or questions, we welcome those in the chat. Just a reminder to everyone, you will be getting, if you registered, you will be getting a follow-up email. It will contain a video link to Commissioner Milner's opening comments as well as the handouts that we have for you. If you can't wait to see the handouts, you can download them immediately now while the room is still open for the next couple minutes. Thank you again, everyone, for attending, and have a good day.
That does conclude our conference for today. Thank you for your participation.